Says it will add a warning to two COVID vaccines about the rare risk of mild heart inflammation seen in young adults. And here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
Good to see you too, Emily.
This warning will only apply to vaccines from Pfizer and Moderna. Do we know yet what it's going to say?
We have a pretty good sense of what it will say based on what was reviewed yesterday in terms of these cases at the advisory committee meeting on immunization practices. And it will likely describe the increased rate, but still very rare occurrence of myocarditis or inflammation of the heart occurring in 12 to 39-year-olds in the week after receipt of the vaccine. And it will also describe that anyone who experiences symptoms concerning for this event should be evaluated right away by a physician.
So that was my next question. What can you tell us about these patients? Should they call their doctor or do they go straight to the emergency room?
So what we learned from these cases reviewed yesterday, they were mostly male. Most of them developed symptoms within 2 to 4 days after receipt of an mRNA vaccine and mostly after the second dose. The most common symptoms were chest pain, and some also had shortness of breath. So anybody experiencing those symptoms in the several days after receipt of a vaccine should either call their doctor or go to an emergency room right away if their doctor is unable to see them. And the next steps in the evaluation typically will be an EKG and some blood work. We also learned yesterday that for the patients with this condition, they all were able to be successfully treated with either ibuprofen and rest or sometimes anti-inflammatory like a steroid to reduce that inflammation. They had very good response to these treatments, and they'll all be followed very closely by cardiologists to make sure that they recover completely.
So given that these cases are mild, that this is extremely rare, do you still believe the Pfizer and Moderna vaccines are safe for young adults?
I do. I really do. And myself and people in my field in pediatrics and in infectious diseases, much like people at the CDC and the FDA, are reviewing all of the data possible and trying to report that accurately to families so that they can make informed decisions about the risks and benefits of vaccination. Again, these were very rare occurrences, somewhere on the order of between 10 and up to 50 cases of myocarditis per million doses of vaccine given to people within that age range. So still very rare. And I do still very much believe in their safety, but think it's very important that all of these reports be transparently and thoroughly reviewed and discussed with families so that they can make informed decisions.
Before we let you go, I want to ask you about the Delta variant. You know, no vaccine authorized yet for kids under 12. What are we learning about their risk from this variant?
So what we know so far about the Delta variant is that it's highly transmissible, maybe even 60% more capable of spreading than the UK or Alpha variant that really became able to dominate the US this spring. What was not clear so far is whether or not it causes more severe disease. But the good news is that the available vaccines so far are still highly effective at preventing infection with the Delta variant. So what that means is that, yes, unvaccinated people will be at higher risk for infection with the Delta variant because of how transmissible it is. But that risk is much reduced in places where the population are largely vaccinated and COVID-19 transmission is kept at bay for that reason. So the best thing we can do to protect unvaccinated children is to make sure the adults and the older individuals in their lives are vaccinated in order to keep them safe as well.
Yeah. All right, Dr. Moffitt, thank you so much for your insight every week. We really appreciate it.
Sure. Thanks for having me.